Hi, this is Don Siemens at HIMSS13 in New Orleans, and I have been asking marketers, what are the challenges that CIOs are talking to you about? Here's what they've said.
CIOs are facing major challenges this year, Don. They have pressures from a compliance and regulatory perspective.
I think they're balancing that with new initiatives that they have along the lines of accountable care, analytics, etc.
But it's also the shift from being an industry that takes care of sick people to an industry that helps people be well.
And what's happening is their business may not yet have defined an overall business strategy for them yet. So they have to react to changes in the marketplace without an overriding business strategy.
And trying to do all that within a set budget.
There's so many activities that they're trying to pursue with limited budgets and limited personnel.
Help me reduce costs when it comes to managing my operations within the data center. Help me consolidate information.
Given kind of the challenges fiscally, you have to really think about politically. You got to think about what's really realistically possible in the next year or two.
You know, we see the rise, especially in mobile, of BYOD, bring your own device.
And we see the rise in tablets, understanding trade-offs.
So we know recently there's been some research, about 81% of all physicians, and it's probably a conservative number, have some sort of a smartphone, and about 62% have tablets. They're using this in a day-to-day environment.
If I buy a consumer-grade device, what does that limit me to? If I pay more for a more ruggedized, purpose-built device, like a motion device, what does that get me?
Being able to connect devices in different environments, both within the hospital and outside of the hospital.
The other piece of it is interoperability, using other systems. A lot of hospitals will have multiple systems that are wrapped around the electronic medical record.
More and more reliance on network-based services and computer-based services for healthcare, and with that comes a lot of interoperability challenges.
So with HIEs and ACOs, there's been a lot of interest in how does your systems interact with other systems, how can you share information across systems.
The push for integrating all this data and then making intelligent out of it sounds wonderful. We all agree we need to do it, but that's not easy to do with the type of systems that they have in play.
An HIE will have a slightly different set of requirements than an ACO. Will have a slightly different set of requirements from a public health organization.
So trying to figure out how do I integrate the systems I have, do it in a way that doesn't break my budget because it's not endless, and then really drive the type of intelligence and data that all of their consumers need.
It's all about the data. It's all about getting that data in the right place at the right time in the right format.
I know meaningful use is obviously a top priority. We're seeing a lot more of it here with Stage 2 and moving to Stage 3 by 2015.
So it's really more about how we can get meaningful use underway.
But more people are thinking about how do I continue the momentum we have? How do we, now that we've been qualified for meaningful use Stage 1, how do we get to Stage 2?
How they can work through their EHRs, now that they got many of them in implementation, how they can improve adoption, how they can improve usability, and simplify and ensure that EHRs now fit into the workflow of the physician.
This is an epic time in healthcare. There's so much change going on, being driven by regulation.
It's how do you prioritize, and then how do you actually deliver towards whatever of the 4 or 5 initiatives that they have underway.
And the bar is getting set higher. The regulations are setting the bar higher, and hospitals are trying to meet those standards. It's very challenging.
Difficult time for sure.